Good morning, everyone. I'm Dr. Bill Schaffner. I'm past president of the National Foundation for Infectious Diseases, and I'm also a professor of preventive medicine at the Vanderbilt University School of Medicine in Nashville, Tennessee. I'm pleased to welcome you all here today on behalf of the National Foundation for Infectious Diseases. Now, it's time to talk about flu. For those of you on Twitter, please use the hashtag #FightFlu. It's our distinct honor to have with us today Dr. Tom Frieden, who's director of the Centers for Disease Control and Prevention. He'll be our keynote speaker. In addition, I'd like to introduce our distinguished panelists, Dr. Laura Riley, who's director of labor and delivery at the Massachusetts General Hospital and associate professor of obstetrics, gynecology, and reproductive biology at the Harvard Medical School. She also chairs the immunization task force of the American College of Obstetricians and Gynecologists. And my friend Dr. Paul Offit, professor of pediatrics, Division of Infectious Diseases, and director of the Vaccine Education Center at the Children's Hospital of Philadelphia. All of these folks are experts in their fields, and each of them is very passionate about public health and the importance of prevention through vaccination. Dr. Frieden will tell us how we're doing as a nation when it comes to flu prevention and preparedness. He'll highlight the latest influenza vaccination coverage estimates among all age groups, as well as in pregnant women and healthcare personnel. He'll review CDC's measures for prevention and treatment, and he'll announce a new vaccine recommendation aimed at protecting adults age 65 and older against pneumonia and other infections caused by pneumococcal bacteria. I'll also be talking more about pneumococcal vaccination a bit later. Dr. Riley will explain why flu vaccination is so important in protecting the health of pregnant women and also, ultimately, their newborns. And Dr. Offit will share his firsthand experiences about the impact of flu in children. He'll also talk about the importance of educating parents and healthcare personnel about the impact of flu and the safety of vaccines. We're also pleased to see a strong showing of support from colleagues representing leading public health, medical, government, and industry groups, as well as consumer organizations, as we prepare the public for the upcoming flu season. Joining us today on their behalf are physicians, pharmacists, nurses, public health experts, and parents. Influenza is constantly evolving as a virus, and it's unpredictable, which is why we recommend influenza vaccine every year for everyone aged 6 months and older. What is it about everyone that we don't understand? Healthy people are not excluded. Last year was an unfortunate reminder that no one is exempt from flu's most severe consequences. Flu hit young and middle-aged adults hard last year, and just over 100 children died. You'll hear more about that from Dr. Frieden and the other panelists. There's simply no reason to take the risk. There are many types of flu vaccines available to help protect you from illness, more than ever before, and many locations in addition to doctors' offices to get vaccinated, such as pharmacies, community clinics, health departments, colleges, schools, and many workplaces. This season, there are multiple vaccine options available, including needle-free vaccines and a high-dose option for older adults, and a complete list of the available vaccines you have in your press kits. So let's put these flu vaccines to good use. They don't prevent influenza if they're left in the refrigerator. Don't wait to vaccinate if your first choice of vaccine is not available. Vaccines are available right now, so there's no reason to delay. Following the panelists' presentation, there'll be a Q&A session. And now, to kick all this off, it's my pleasure to welcome Dr. Frieden. Tom?
Thanks very much, Bill. It's great to be here with you, and I really thank Dr. Riley and Dr. Offit, Dr. Schaffner, for kicking off this year's flu season with us at CDC. We have some new information, but the bottom line here is that there's one thing to know about flu. It's unpredictable, and the best thing you can do to protect yourself, your patients, your family from the flu is to get a flu vaccination this year and every year. It is safe and effective. I get a flu shot. I took my 10-year-old for his flu inhalation or intranasal last Saturday, and we recommend that everyone 6 months and over get a flu shot this year and every year. We can't predict what this season is going to be like, severe or less severe. We can't predict exactly which strains are going to be circulating, but we can predict that the best way you can protect yourself against flu is to get a flu vaccination this year, and now's the time to start getting one. Now, I'd like to just recap what happened last year. Last year, as you may remember, it was a relatively bad year for flu. There were tens of millions of illnesses. Lots of people went to the hospital. It hit young adults and middle-aged people harder than it usually does, and they accounted for a larger proportion of cases. Last year, it was predominantly the H1N1 strain that first emerged in 2009. That strain remains in this year's flu shot, and you need this year's flu vaccination to protect you against this year's flu. Now, last year, we also saw more than 100 documented deaths in children from influenza, and that's a terrible tragedy. Many of those deaths might have been prevented if children had gotten a flu vaccination, and there are so many options now, different forms of vaccination, small needles, less small needles, intranasal vaccinations, and so you really should try every way you can to protect your kids and your family from flu, and for physicians to make sure that you set it up as a routine. So it's not taking an extra step to make sure that you're helping your patients protect themselves and their families, but you yourself are getting a flu vaccination and you're ensuring that your patients are routinely offered that as well. Of those more than 100 kids who died with flu, first off, we know that the actual number is higher because we're not able to identify each such tragic event. We know that about half of those kids didn't have a pre-existing condition. So they didn't have some health problem that would have identified them as high risk. And we know that the overwhelming majority, around 90%, didn't get a flu shot. So please, get a flu shot for yourself and your kids this year and every year. There are many more options for flu vaccination. Now, I also want to tell you about another important report that CDC will be releasing today. We're reporting flu vaccination coverage rates among healthcare providers. And for the first time, we're reporting that because of a terrific collaboration between CDC and CMS. Our two organizations are figuring out ways to work together to help get more value for our healthcare dollars, to help protect patients better, to help improve the quality of care. And what CMS has done is to require that healthcare facilities report on their flu vaccination rate, and we check to see if that reporting matches other surveys that we do to look at the vaccination of healthcare providers. And they're quite close, so we're encouraged that this data seems representative, and it's encouraging. We know that now data was reported from more than 4,000 hospitals, and that represents about 85% of such hospitals in the country. That is the most complete accounting available for this measurement, and we looked at that by employees, by types of practitioners, and by trainees and volunteers. And overall, 82% of healthcare providers working in these hospitals were reported to get a flu vaccination. That's encouraging because we've seen steady increases. The highest proportion was among hospital employees, 86%, the lowest among independent licensed practitioners, that was at 62%. That's a baseline to look at the future because what gets measured can get managed, and we anticipate seeing those numbers continue to increase now that we have a system to track them. That's important. By healthcare providers getting vaccinated, they're protecting themselves because they're at higher risk of getting flu when they're taking care of patients. They're protecting their families and they're protecting their patients. influenza vaccination for healthcare workers is a patient safety issue. And hospitals that do things like have multiple days when their employees can get a free flu vaccination are much more likely to have a higher rate of flu vaccination. That's a bottom line. The easier we make it for people to get a flu vaccination, the more likely it is that they will get vaccinated. We still are seeing numbers lag in places like nursing homes, long-term care facilities, allied health workers, people who work at various levels of the hospital, so there's more to be done there. I want to also give you the final vaccine coverage estimates for last flu season. Last flu season, about 46%, about half of all Americans 6 months and older were vaccinated against influenza. Now, you can be a glass half full person or a glass half empty person. I would like, in this case, to say it's really unfortunate that the half of Americans are not getting the protection from flu that they could get, because the result of that is a lot of days missed from work and school, a lot of suffering, a lot of hospitalizations, and a number of deaths that could have been avoided. I'm happy to report, though, that last year more kids got vaccinated than ever before. The estimated coverage was 59% overall among kids, so most kids are getting vaccinated. And interestingly, Asian, Hispanic, and American Indian, Alaska Native kids had higher vaccination rates than either African American or white kids in America, who had similar rates, around 55, 57%. Dr. Offit will say more about protecting kids against flu, but I want to make one point, and that has to do with kids with asthma. There's been a lot of understandable media attention to the clusters of EVD68, enterovirus D68. We've seen this virus a bit before. It tends to peak in the fall, so we're seeing a lot of cases in many states around the U.S., and we may well see more cases. Many of the kids with the most severe illness were kids with asthma. So making sure that asthma is well controlled and that every kid with asthma gets a flu shot is very important, and more important than ever this year. Among adults overall, the rate remained 42%. And unfortunately here there were big differences between different race and ethnic groups. For whites it was 45%, for Asians and American Indians about the same, but it was much lower for African Americans, Hispanics, and people of multiple races. We also need more adults under the age of 65 to get a flu shot. Of adults 18 to 64, only a third, 34%, got a flu shot. This is the working population. That's a lot of days of work missed. That's a lot of suffering and pain because people didn't take the couple minutes to get a flu shot. We need to make it easy for people. We see that a large proportion of flu shots are now being given, flu vaccinations are now being given in pharmacies and at workplaces. There are more options than ever for flu vaccination, so we hope to see that number increasing because it will really help. And last year was a bad year for people in that middle-aged group in terms of flu. We're particularly concerned about the low rate of flu vaccination for adults with high-risk conditions like asthma, and lung disease, and heart disease. They're at higher risk for ending up in the hospital or intensive care unit or even dying from flu, and yet their flu vaccination rate is only 46%. Last year, 65% of 65-year-olds got a flu vaccination. Typically, most of the hospitalizations and deaths are in this population. We do have some more options for vaccination among the elderly. And we've seen big differences between different states and how they do on flu vaccination. Now, I'd like to turn to two reports in today's MMWR. The first is about pregnant women. And here, I'm encouraged that most pregnant women are now getting a flu shot. But it's only just barely most. It's 52%. And so we know that it's important because pregnant women are more susceptible to severe complications of flu, and Dr. Riley will be talking more about that. We also know that nurses often lead the way. And I didn't say that just because a nurse is going to give me my flu vaccination later today. Nurses led by example and reached the 90% goal last year. 90% of nurses got a flu vaccination, joining doctors who've also reached the 90% goal. You know, the more you know about flu, the more likely you are to get vaccinated. I'm getting my flu vaccination, and I recommend that everyone 6 months and over get theirs unless they have an absolute contraindication. Overall, about 3/4, 75% of healthcare workers get a flu shot, and we're seeing a big increase in healthcare workers working in hospitals, up to 90%. Now, we do have another vaccine recommendation, and that has to do with a new pneumococcal vaccination. Pneumococcal disease causes pneumonia. It can be severe, and we've had one form of pneumococcal vaccine for people 65 and over. We are now recommending a second form of pneumococcal vaccine, what's called a conjugate vaccine. It's been tremendously effective in kids, and we've seen the number of pneumococcal cases plummet in recent years, and the Advisory Committee on Immunization Practices has now recommended that people 65 and over get this newer vaccine. So the most important group are those turning 65. We want to make sure that when you go in for your flu shot, you get this newer vaccine if your doctor has it. We're encouraging doctors to stock it, and insurers have told us that they will reimburse for it. So that's a new vaccine recommendation, and that's the most important group for it. There's a lot more detail about who should get that vaccine and how you deal with two different vaccines. It's a little complex, and I'll let other people deal with that. But bottom line is, if you're turning 65 this year, you can look forward to not just an influenza vaccine, but an even better anti-pneumonia vaccine. Finally, I'd like to conclude with a couple of comments about flu overall. At CDC, we have a three-step approach to fighting the flu. First and foremost is to get a flu vaccine. Everyone 6 months and over, now is a great time to get vaccinated. New this year, we're preferentially recommending nasal spray vaccine for healthy children 2 to 8 years old who don't have any contraindications or precautions when it's available immediately. But if it's not available immediately, by all means, get any form of flu vaccination. They all work. They don't work as well as we would like, but they're the best way to protect yourself against flu. Second, we recommend that for fighting flu and other respiratory illness, take everyday preventive actions. That means stay at home if you're sick. If you're sick, stay away from other people. Have good hygiene, like washing your hands often and covering coughs and sneezes. And finally, if you do have symptoms of flu, particularly if you have an underlying condition and your doctor prescribes antiviral medicines, take them. They're a good second line of defense against flu. Again, bottom line, we can't predict what this year's flu season will be like, but we can predict that the best way to protect yourself is to get a flu vaccination. Thank you very much.
Thank you, Tom. Your dedication to the prevention of influenza and pneumococcal disease is very evident, and we appreciate your passion in this regard. Dr. Riley will now tell us a little bit about her perspective as an obstetrician regarding flu in the pregnant woman and in her newborn.
Thank you. Good morning. So my life is spent on labor and delivery units and hopefully delivering as many healthy babies as possible and making really wonderful families. But one thing that's clear is that no otherwise healthy pregnant woman should ever have to go to an intensive care unit, gasping for air and trying very desperately to save her newborn from delivering prematurely. It's just not fair, and it's unnecessary. During pregnancy and in the immediate postpartum period, influenza can lead to severe respiratory infection and even death. And when mothers become this acutely ill, they are at risk for delivering their babies way too early. The best prevention for the flu, as you know, is the flu shot. An overwhelming number of studies have shown that the flu shot is safe in pregnancy during all trimesters. There is no increased risk of birth defects, of miscarriage, or preterm delivery from the vaccine itself. The vaccine benefits the mother because it prevents severe illness for her, and it protects the baby from infection in the first 6 months of life before the baby can be vaccinated. So as Dr. Frieden stated, last year, only half of pregnant women received their annual flu shot. We can do much, much better to protect mothers and unborn babies from this preventable illness. We know that a strong recommendation from obstetricians, nurses, and midwives can increase the number of pregnant women who will accept vaccination. So here is my strongest recommendation. Don't delay, get your flu shot.
Thank you, Laura. And we've been doing a little bit better. The moms are accepting and the docs are giving it, right?
Yes.
We're making stepwise progress and we have more to go. Paul Offit, come on up here and tell us about the impact of flu in children.
There is not a year that goes by when a child dies at the Children's Hospital of Philadelphia from a vaccine-preventable disease. Occasionally it's pneumococcus or whooping cough, pertussis, but mostly it's flu. When the 2009 pandemic hit, we had 5 children die of influenza, and you should see this. I mean, because here's the way it looks. So there was a friend, actually a child of a friend, who came in a number of years ago who was 8 years old, and he came into the emergency department laughing and joking, requiring face mask oxygen. But over a period of 8 days, he went from face mask oxygen to CPAP, which is just continuous positive airway pressure, to a ventilator, to an oscillator, to a heart-lung machine, and then he died. And you watch these parents every day go through this event where they're watching their child essentially fall off a cliff in slow motion. And then you, in your practice, see parents who are choosing not to get a flu vaccine. And it's impossible not to be passionate about this because, to watch these parents lose their future is hard. The parents' reaction is invariably the same. They can't believe it. They can't believe this happened to them. I mean, and so what they then do is they invariably become members of parent activist groups like Families Fighting Flu, the Amanda Kanowitz Foundation, or all foundations founded by parents whose children have died of flu. But their reactions are all the same. They just can't believe it. I can't believe this happened to me until it happens to you. I think part of the problem here is that is the word flu. We'll often say, well, it's just the flu virus. I think we don't really understand what influenza is. Influenza makes you sick. The old medical school aphorism was that if medical students really want to know what it feels like to be sick, they should get flu. You can often detect or remember the exact hour when your illness started with high fever, headache, shaking chills, progressing to congestion, coughing, and occasionally lower respiratory tract disease, pneumonia. So we confuse it with other viruses like rhinoviruses, which are much more trivial. But there's nothing trivial about flu. And so I think what I'm going to sort of end by challenging Drs. Frieden and Schaffner to come up with a new name. I think we need a new name for influenza virus. I mean, over the past week, I have been asked 1,000 questions by reporters on enterovirus D68 and Ebola, which combined have caused about 0 deaths in the United States, and yet flu causes thousands of deaths. But I think we need to sort of maybe give it a Greek letter designation and an interesting city name, I think preferably from an exotic city. But I think that's the biggest problem with flu is its name. So thank you.
So thank you, Paul. And we might just reinforce Paul's comments by remarking that of the over 100 children who died last year, half had no underlying illness at all. They were perfectly normal children infected by fierce influenza. How's that?
You're getting that.
I'll work on it. I'm now going to take just a few minutes to review influenza and pneumococcal vaccination recommendations for the persons out there who are 65 years of age and older. A high-dose flu vaccine is now available for that group, and that provides a larger dose of antigen. That's the part of the vaccine that actually stimulates the body's immune response to create antibodies. New data, recently published in the New England Journal of Medicine, indicate that the high-dose vaccine leads to significantly higher antibody levels in people aged 65 and older, and also that those higher antibody levels translate into greater protection against influenza. So the vaccine really does its job as intended. Getting influenza also increases a person's risk of getting pneumococcal disease. Influenza in and of itself is very bad, but it also leads to complications. And one of those complications is pneumonia, and pneumococci, these bacteria, are the leading cause of that pneumonia, and they can also cause pneumococcal meningitis and bloodstream infections. So these infections, these pneumococcal infections, are particularly deadly for older people. But even in younger people, pneumococcal disease often requires hospitalization and weeks to recover before returning to normal activities. This makes it critical that everyone in the recommended age groups is protected against both diseases now that influenza season is approaching. As Dr. Frieden said, for those 65 and older, the CDC now recommends 2 vaccines against pneumococcal disease. The conjugate vaccine, known as PCV13, already recommended for universal use in children and with powerful effect, is now recommended for adults age 65 and older. That, along with the well-known and long-used polysaccharide vaccine, also known as PPSV23, which has been used for many years in the 65-plus population. And if you'd like to discuss the details about how those vaccines are to be administered, we can do that later in the Q&A session or after the news conference. This new combination of pneumococcal vaccines is expected to reduce vaccine-type pneumonia in people aged 65 and older by about 45% and reduce invasive disease, the most deadly form, by 75%. These represent very significant decreases in illness for this 65-plus age group in our community, who suffer more than 50,000 hospitalizations each year for pneumococcal pneumonia alone. So together, the vaccines will provide the best protection against pneumococcal disease. The 2 vaccines cannot be given at the same visit. Ideally, the conjugate vaccine is given first, followed by the polysaccharide vaccine 6 to 12 months later. Excuse me here for a minute. Now, what I'd like to do is invite Sharon from the MedStar Visiting Nurse Association to the podium to vaccinate Dr. Frieden, who will demonstrate his personal commitment to the prevention of influenza as he has done in the past.
Stand?
Relax that arm now.
Question is whether you watch or not. Hardly felt a thing. So you can fit this into any busy schedule. Great.
Thank you.
Thank you very much.
Oh, Tom, can you just hold up?
Oh, I'm supposed to hold this up?
One photo, thank you.
One photo. Thank you.
Sharon, thank you for doing that so efficiently, and thanks to Dr. Frieden, our country's leading preventionist, who's also obviously a very good sport. Thank you. Now for the question and answer session. This is reserved for questions from the media. We've got 2 roving microphones. Please indicate that you have a question, raise your hand and someone will come over with a mic. Please remember to identify yourself and the media outlet you represent. For the media participating via the webcast, please email your questions as indicated on the webcast. If you're on the teleconference, the operator will come on the line momentarily to advise you how to submit your questions. And finally, if you'd like to schedule one-on-one interviews with any of the speakers or representatives of the supporting organizations present, one of our staff here can arrange that for you. and a full list of those organizations is available to you in the press kit. So who'd like to ask the first? Maggie.
Lauren Neergaard with AP. A couple of questions. First of all, how much flu vaccine is there this year? How much is quadrivalent? And Dr. Frieden, are you going to be pushing for all of it to eventually be quadrivalent, and how soon? And then I also have a question for Dr. Offit.
The answer is there's plenty of flu vaccine. 77 million doses are quadrivalent, or 4 different strains, and we'll be working with the manufacturers to see about increasing that proportion over time.
Lauren, do you have another question?
And Dr. Offit, it was said earlier that the enterovirus means we really need to be sure that we're vaccinating kids against flu this year. Can you talk a little bit about that? Is that going to complicate things just to have the 2 different similar infections going around at the same time?
Well, I mean, they're both respiratory tract, lower respiratory tract infections, so in that case they're similar, but they're distinct certainly immunologically. I mean, the flu vaccine will prevent influenza virus and influenza virus only. It's not going to do anything for the enterovirus D68. I mean, certainly, we see a lot of mixed respiratory virus infections in our hospital. Well, you'll see often, 2 viruses that are infecting at the same time. It's certainly possible that could be true here, but so that makes it all the more important, I think, to make sure that you get your flu vaccine. Sure.
Is there another question? Yes, please.
Hi, Carlos Bongiovanni, Stars and Stripes newspaper. You mentioned, Doctor, earlier about the parents who would never suspected that their children would die from influenza. I'm just wondering, do you have any statistics of how many of those children that died had the vaccine and how many didn't have the vaccine?
Certainly, I mean, the experience at Children's Hospital of Philadelphia is invariably they haven't had the vaccine. I mean, so if you look nationally, the typically children who die have not been vaccinated. So the numbers, I'm not sure that those numbers are known, but I think one can say sort of the largest percentage. It's certainly true when you look at vaccine-preventable diseases in general, so like the current measles outbreak, that the vast majority are unvaccinated.
For influenza, of the children who die, about 90% were not vaccinated. That's in contrast with overall, where we're at close to 60% are vaccinated. So 90% not among those who die versus overall 57% vaccinated.
So Laura Scott from Families Fighting Flu, say a few words about that. Why don't you stand
Sure.
up, just please, so they can all see
I'm
you.
Laura Scott, representing Families Fighting Flu, which is an advocacy organization made up of primarily of families who have lost children.
I need to come to them.
Oh.
To the middle.
Oh, I'm sorry.
Why don't you-
Laura Scott with Families Fighting Flu. We are an advocacy organization made up of families who have primarily lost children to influenza or whose children have been hospitalized. The majority of our members or advocates, children were not vaccinated against the flu. And as Dr. Offit said very well, that these families are left shocked and devastated and cannot believe that their children actually died of this vaccine-preventable disease. So you ask any of them now, they absolutely will push the vaccine, and all of them believe that had their children been vaccinated, their children may still be here today.
Thank you, Laura.
Thank you.
Very heartfelt. Yes, please. Here we go.
Donna Young with Script. For those parents who didn't get their children vaccinated, what was the reason? And for those who died, as well as others who haven't gotten their children vaccinated, what's the reason that you're finding most often?
Paul?
Either one of 2 things. Either one, they consider influenza to be a trivial infection and not worthy of prevention, or 2, they have false or at least scientifically unfounded concerns about safety issues. That the flu vaccine causes the flu, that the flu vaccine doesn't prevent the flu. I got the flu vaccine and, I got sick from it. That it causes other things like Guillain-Barré syndrome, and so for that reason they don't want to get the vaccine. I think it's our inability to understand risk. I think we don't really know where the real risks lie. Frankly, the riskiest aspect of getting vaccines in general is driving to the office to get them.
I would just add to that doctors can do a lot here. That doctors making it routine and easy for kids to get vaccinated increases the vaccination rate. And for many of the kids who weren't vaccinated, it wasn't that the parent didn't want a vaccine, it was just that the system didn't work for them.
So Dr. Beers, come on up here, Dr. Laura Beers, Dr. Lee Beers from the American Academy of Pediatrics. Why don't you say a few words about how those pediatricians are working to get everybody vaccinated?
Absolutely, absolutely. And I would agree with all the comments that have just been made about why parents don't get vaccines. I think it's scary, and when it's something that you don't fully understand and you see media reports about, I agree, false, scientifically unfounded information about the dangers of the flu shots, it's hard to know how to make a decision. But I think as pediatricians, we're trusted advocates with the family, and so having a good relationship with families, we can talk about that together. One of the first things I do is I tell parents, I get the flu shot every fall. My school-aged children get the flu shot every fall. They've been getting it since they were 6 months old. And if I didn't, in my heart, believe it was safe, I wouldn't take them to get it. And so I think being able to have that conversation, have a discussion about what the concerns are, what their fears are about risk, really helps, and it helps parents make a decision. So.
Thank you very much.
One quick
Yeah,
thing.
please,
Thank
Paul.
you. I completely agree with that. What you've seen over, say, the past 30 years is, I think, a change in the way that pediatricians interact with their families. You want the patient and the parent to buy into what you're doing, and so at some level, you want them to make the decision. And when you do that, you cede your expertise and experience at some level. So. We're not as strong or passionate about vaccines, I think, as we were decades ago. I think there's probably no better example of this than the human papillomavirus vaccine, which is horribly underutilized. And I think that we need to be stronger. We need to be more passionate. You don't have to work in a tertiary care hospital like I do to know that children can die from this and to watch children die from this, or to have, the parent advocate groups like Parents Fighting Flu, who have seen this happen. I mean, it does happen, and you don't want it to happen to your child. It's a game of Russian roulette. I mean, it's not 5 empty chambers, it's 100,000 empty chambers, but it's still a game you don't have to play, and I think people don't see it that way. We need to be far more passionate in the front lines. I completely agree.
So I have another question here, and it has to do with pediatric immunization. We seem to get a lot of interest in that this morning, and that's very good because children not only need to be protected themselves, they're the great distributors of influenza virus in the community, right? They share it amongst themselves and then bring it home to mom and dad and to granddad. So the question is, and this is to Paul for starters, why is it now preferentially recommended that children 2 to 8 receive the nasal spray vaccine if it's available?
Right. So the live attenuated influenza vaccine, or nasal spray vaccine, actually was a vaccine that was originally developed in the 1960s at the University of Michigan, so there's a lot of data and experience with this vaccine. It's made using a scientifically different strategy than the inactivated vaccine. The inactivated vaccine is made by taking influenza virus, growing it up, relatively purifying the 2 surface proteins of that virus, the hemagglutinin and neuraminidase, and the virus is completely inactivated, and then giving it as a shot. The live attenuated vaccine is attenuated, it's weakened, which is to say it is adapted to growth at a temperature about 2 degrees cooler than body temperature. So therefore it can't possibly reproduce itself at core body temperature. Rather, it reproduces itself at a temperature 2 degrees cooler, which is to say that of the nose. And so it induces, therefore, frankly, a better response in the upper respiratory tract. And the data for young children in the children, the 2 to 8-year-old age group, is that it is a better vaccine. Both are excellent vaccines, both work, but the LAIV is better in that age group. So this is not, there are a number of other countries that have already expressed a preference. There are 2 states in this country, Oregon and Washington, that already have expressed a preference. So now this preference has occurred at the national level.
So it's a preference, but not everyone will have LAIV. Not everyone will have the nasal spray vaccine available. And so the secondary note is parents shouldn't shop around too much looking for it. Make sure your child is vaccinated against influenza vaccine. With influenza vaccine that's available, because the vaccine that's deferred is often the vaccine that winds up not being received. So the important thing is get your child vaccinated. We have another question here from CBS News from Dana Carvillo. Can you talk about, Dr. Frieden, the current supply of vaccines for this season? You've said a few words about that again, and there's a sub-question here. Are there shortages or delays?
We're confident that there will be ample supply this year. We're told by the manufacturers that they'll be bringing about 150 million doses of flu vaccine to the market. There are many different options. It's always possible that in one doctor's office or even one area, you may have to shop around some, but there is plenty of flu vaccine to go around. We hope that everyone will take advantage of it.
Great, thank you. And a few more questions here. Are there any strains of influenza out there that are of particular concern this season? I think we predict in our cloudy crystal balls that we anticipate the circulating strains this year will be very similar to the strains that were around last year.
We'll really have to see. We have to see what happens. Last year, it turned out it was H1N1, the strain that we first saw in 2009. We track influenza around the world. It's a wonderful global collaboration because we work to help other countries track and respond to flu better. And when they do that, we have better information of what we're going to do. And that's something that we'll be looking at very closely. We hope that this year's vaccine will be a good match with all of this year's flus, but whether it covers all or whatever proportion, only time will tell. Again, flu is unpredictable. The only thing we can predict with certainty is that the best way to protect yourself against flu is to get a flu vaccination this year.
I think we can also predict that there will be flu.
Yes.
Absolutely. Further questions?
Hi, I'm Kimberly Leonard from U.S. News and World Report. For people who don't have health insurance, how much does the vaccine cost?
The vaccine costs a variety of amounts depending upon your resource, but you can also, people who don't have medical insurance can go to their public health clinics, and many of them are providing vaccines. Tom, do you want to?
We'd have to get back to you with the exact information on cost. But, you know, as we just released information about yesterday, an increasing number of Americans have insurance coverage. And as an ACIP recommended vaccine, there are no co-payments for flu vaccination among virtually all people who are now covered with health insurance. For those without health insurance, there are options locally. You should check locally for what you can do to get a flu vaccination least expensively.
Can I ask one more?
Please.
You mentioned earlier that among the African American and Latino population that there's a very different percentage of people who are actually vaccinated. Do you have more specific numbers on that? I didn't see it in the report.
We can give you the numbers. The trend is quite interesting. If you look at children, actually the vaccination rates are higher among African American children than among white children. But if you look among adults, they're lower. One of the issues is access to care. And when people have access to care and are cared for by doctors and nurses and physician assistants who make flu vaccination a routine part of care, they get very high vaccination rates. For adults, there may be less access to care, and in some communities, there's concern about the needles or concern about the vaccine. That's why it's encouraging. The needle I got was a big needle, but they have little needle vaccines, too, that many adults can get. So there are lots of options, and we really encourage, and up to age 49, you can get the intranasal vaccine as well. So we found that fear of needles is one of the reasons that some people don't get vaccinated.
So from the Hospitals and Health Network, here's a question. Are there steps that hospitals can take to increase the number of staff getting vaccinated, particularly independent physicians, that is, physicians in the community who practice in the hospitals? And hospitals have been doing that through a variety of mechanisms, making the vaccine widely available, making it available free, making it as easy as possible. Sometimes at medical grand rounds or pediatric grand rounds, once you leave the grand rounds, you can get vaccinated right on site. And then, as the questioner suggests further, or observes further, that many hospitals are now making it a condition of employment. So that clearly has assisted in driving immunization rates up.
Can I comment on that?
Sure.
Well, I'll tell you how we did it in our hospital. Starting in the early 2000s, we had the immunization rate among our healthcare workers was around 35%, which is pretty close to the national average. By healthcare worker, I mean anybody who could walk into a patient's room. So it's not just doctors and nurse practitioners, but environmental services, dietary services, all of those are healthcare employees. So we had about 10,000 healthcare employees at our hospital. And we did a variety of things. I mean, we had, we certainly brought, it was free. We brought the vaccine right to the place where people worked. We had educational modules, which you could see on our intranet. We had, giveaways. We would do things like give away 76ers tickets at a time when they were still competitive. I mean, it was all good. And we got immunization rates up to sort of in the mid 60% range. Then what we did is we had a declination form, which said that on the front of it that I know that there are children who come into our hospital with influenza. I know that there are children that we can spread influenza as caretakers from one patient to the next. I understand that there's a vulnerable population in this hospital who can't be vaccinated because they're getting, chemotherapy for their cancer or immune suppressive therapy for their rheumatologic diseases, or because they're too young, less than 6 months of age. I know I can transmit that virus. I know that they can catch that virus, and I know that they can die from that virus. I mean, that's the way it read. It really read like it should have had a skull and crossbones on the front of it. And still about 20% of people signed that form that they did not want to get the vaccine. And on the back, we asked them to explain why, and it was the usual reasons. I get flu from the flu vaccine. I never get flu, whatever. So then what we did is we'd had enough. We in 2009, as Bill alluded to, we mandated a flu vaccine, which is to say that if you chose not to get an influenza vaccine in 2009, you had 2 weeks of unpaid leave to think about it. If you still didn't want to get vaccine, you were fired. And so we fired 9 people in 2009 because they refused the vaccine. No one has refused since. We did not accept it, just so you know how this worked exemption-wise. Obviously, we would have accepted any documented medical exemption. We did not accept the philosophical exemption because it didn't make sense. What's the philosophy? Nietzsche? I mean, that which doesn't kill me makes me stronger. I mean, we would not accept that. We did accept religious exemptions. This was always very tricky. The way that they put me in charge of this the first year, the way that worked was I said that you just had to have a letter from the cleric of your religion showing where in the major text of your religion it says you shouldn't get vaccinated. Got a lot of notes from yoga instructors. That didn't count. But we have full compliance for that vaccine because we've had 2 children die in our hospital, both in around 2003, who came into our hospital without flu. They were cancer patients, and they caught flu. They couldn't get a flu vaccine because they were immunosuppressed. They caught flu in our hospital and died from flu. I mean, who's responsible for them? We feel we're responsible for them. And if you choose to work in the healthcare situation, in our case, among a vulnerable population of hospitalized children, it's your duty to make sure that you don't spread that virus. So we just were not lenient anymore.
Is he vivid? Is he vivid? Influenza immunization of healthcare personnel is first and foremost a patient safety issue. We do not wish to give influenza virus to our already somewhat sick and sometimes seriously sick patients. And the only way we can assure our doing our best to do that is by being vaccinated. Staying home when you're sick is only a partial solution, because the day before you become sick, you're already breathing out influenza virus, and you could then cover your patients with the virus. So the only way we can try to prevent that is by immunizing ourselves in advance. I'd like to take a moment and ask Dr. Riley once again to emphasize the importance of influenza immunization in protecting not only the mom, but the newborn baby during those first 6 months of life before we can directly immunize the baby. How does that work, Laura?
So I think someone asked, why do people say no to the vaccine? And I think, this is a conversation I have every day with pregnant women who are concerned about the safety of the vaccine. I think there's lots of data to suggest that it's safe. I think what really is most appealing to mothers who want to just protect their babies at all costs is that the only way to protect a newborn between 0 to 6 months of life is for mom to get vaccinated. She develops antibodies. Those antibodies cross the placenta, and they protect the baby during the time that the baby is most vulnerable. It is the only thing that is available. We know that the minute the baby is out, the baby is exposed to whatever is in the environment. I'd just like to say, at our hospital at Mass General, and on our labor floor and the postpartum floors, we have like 99.9% of people got vaccinated last year. We had one person who had to walk around with the scarlet letter of a mask, which was ridiculous. So, I mean, I think that you can make the recommendation to healthcare providers, and I think at the end of the day, it really is a responsibility issue, and I think none of the nurses or doctors or, you know, the women taking the dietary trays in and the gentlemen who were doing, you know, their jobs as well, anybody who had contact with moms and babies understood that it was their responsibility to protect those patients. Those babies have no other protection.
And that's a passionate person also. Dr. Frieden, you have to run. Thank you always for doing this. Thank you very much. We have time for just a couple more questions from Parents Magazine. Is the nasal spray a better vaccine option for healthy adults as well as children 2 to 8? Once you cross the threshold of about 8 years of age, the vaccines are of comparable effectiveness going forward. So there's less to choose then going forward. And, pardon? And don't use it in pregnancy, that's correct. Pregnancy is a specific contraindication. It's available for use age 2 up until the age of 50 if you're otherwise healthy. That is the nasal spray vaccine. Those are the licensed indications. From Stacy Burling from the Philadelphia Inquirer, has the flu season started anywhere in the country at this time? Well, flu is always with us. So let me tell you about a colleague who called me about 2.5 weeks ago. His patient was in her 90s, was an independent person, had no major underlying diseases, but she developed a cough, a persistent cough that her family suggested she see her very good primary care physician about. She chose not to do that. 2 days later, that is 2 nights later, she was found parked in an awkward way at the side of the road by police officers. She was somewhat delirious, coughing. She had been out trying to get to her private physician's office. She was admitted to the hospital, and as things sadly eventuated, within 3 days died. And when she came into the emergency room, they were clever enough to actually do a test. She had diagnosed influenza, late summer influenza. So influenza is always with us. It hasn't taken off yet anywhere in the country as we think of the influenza season, but it's out there, lurking, ready to strike. Perhaps one more question. Yes.
Tucker with Medscape. Just wondering if you can summarize how it works with the 2 pneumococcal vaccines. It's a little bit confusing, the recommendations.
So the recommendation has to do with the pneumococcal vaccine and how it works. There are various ways to do that, but the most straightforward way is once you reach age 65 and you haven't been vaccinated against pneumococcal disease in the past, the recommendation is that you get your initial vaccination with PCV13, the conjugate vaccine, and then wait 6 months to a year, and then get vaccinated with the polysaccharide vaccine. And there are other combinations and permutations, and we can discuss those a little bit later. It gets kind of complicated, I must say.
Right.
If you've had the polysaccharide vaccine, then you wait at least 6 months before you receive the conjugate vaccine. Correct. Lauren, you need to wait in order to maximize the immune response and also to minimize sore arms.
Yeah, I mean, what
you know, when you get the polysaccharide vaccine, you get an immune response, right? The PCV13 has obviously many of the same serotypes. So you want that immune response to settle down so that you're not sort of neutralizing the antigen with the antibodies that are circulating in your bloodstream.
Right.
That's why. It'll lessen the effect, yeah.
So, thank you very much for all your attendance. Let's hope for, shall we say, an uneventful flu season. But as we've heard from the experts, our best defense is a good offense. I want to thank all the supporters of this. Thank you all for coming, writing your stories, transmitting them electronically and in every other way. It's so important. We appreciate your opportunity. And all of you have available the opportunity to get vaccinated against influenza right here, right now, at no cost. Thank you all.